How are you?
Good.
All right, that's good. My name is Prisha Barr. I'll be your student physical therapist for today.
Okay.
Okay, so what we're going to be doing today is called manual lymph drainage. And I'm pretty much just going to be rerouting the lymph fluid to working vessels, and we're going to try to get it back to your venous return system, okay?
Okay.
All right, I'm just going to go ahead and clean up my hands and warm them up. Do I have permission to touch you?
Yes.
Okay, that's good. And when I do this manual lymph technique, I'm going to just work each spot for 2 to 3 times. Normally I'll do it for 5 to 7 times, okay?
Okay.
All right. So I just want to go ahead and inspect your skin to make sure everything is okay. I'm just looking for any surgical incisions, any scars or bruising. Okay, everything looks good. Can you feel this?
Yes.
Okay, good. Just want to make sure that your sensory is intact. All right, so first I'm going to start off right above your clavicle, around your neck area. So I just want you to relax and just continue to breathe for me. I'm just warming up my hands back here. So like I said, we're just going to do 2 to 3 strokes. Okay, so next we're going to do the effleurage. We're just going to move a little bit lower. We're going to be under the clavicle now. So I'm going to do a sweep motion with both hands, and we're going to go like in outward circles. Okay, how you feeling?
Good.
All right, so next what we're going to do is we're going to get started on the right axilla. So I'm going to be in the area of your armpit.
Okay.
And just rest your arm back here into my hand. So I'm just going to take the skin and put a stretch on it. And then we're going to work towards the middle of your chest. Okay, how are you?
Good.
All right. So next we're going to go down into your diaphragm.
Mm-hmm.
I'm just going to drape you on top. So here I just want you to go ahead and breathe normally for me. I'm just going to note your breathing pattern. And give you a scoop on exhale. Okay. So now I'm just going to address the upper right quadrant, and we're going to work the fluid upwards. Okay.
Okay.
Just take my hands, go up. All right. So now we're going to do the other side. And we're going to go in the upper motion just the same way. Okay. So now we're going to go back into the middle and just one stroke. Alright. So now we're going to address the lower right quadrant. And we're going to push the fluid downward. Again, we're just doing 2 or 3 strokes. for the left. Okay. So before we go down to the inguinal, I'm just going to do one more stroke in the middle here. Good job breathing. All right, good. So now I'm just going to roll up your pant leg here. And we're going to mobilize the fluid towards the inguinal lymph nodes, okay? So I'm just going to take my hand here. We're going to go up and in for 2 more strokes. Up, in. Okay, how does that feel?
Good.
All right. Same thing for this side. I'm going to go up and in. Relax with the skin. Up and in. All right. So now we're just going to work our way back up. Make sure my hand is still warm. And we're just going to do 2 strokes for the sake of time. In the middle again. Back to the right. And the left upper quadrant. Go back central one more time. Okay, good. So before we get to the left side, we're just going to adjust the right upper extremity one more time. And just rest your arm in my hand. And again, I'm just going to push the fluid centrally. So I'm trying to go towards the sternum. Okay. And lastly, I'm just going to go over on your left side, and we're going to move the fluid towards your sternum as well. Okay. And you can just rest your arm in my hand. And we're going to work the fluid centrally. Two. Three. All right, good. So do you have any questions or concerns?
No.
All right, so that's going to conclude our manual lymph drainage for today. Before you go, I want you to know that there's some things that you should look out for. You want to be careful with lifting very heavy objects. Be careful at home with lifting your child. You don't want to take very hot scalding baths or showers. You want to make sure the water is lukewarm or cool. And you don't want to wear tight garments, okay, because you want to keep that fluid flowing easily without any constriction.
Okay.
All right, thank you.
Thank you.